This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everyone. Many times before, here on this show, and even just conversation in our normal lives, many times we talk about the things that are wrong with us. Oh, I got this going on. I got that going on. So it's good. It's on your radar. But instead of looking to eradicate the issues, what about if we put a spotlight on some of the things that we should focus on, almost in a way to squash the negative things out? Like, imagine if you had better balance in your life. Maybe you had fluid. You're moving forward. You feel like you're stuck in life. Imagine if you were better connected with you as opposed to feeling like you're a little off all the time. All of those things and so many more achievable with this thing called Chinese medicine. And with that comes herbals. We're talking many, many hundreds of years of experience, and we're still talking about it today. Again, acupuncture. We're going to talk with somebody who, she's our expert on that. So much to dig into today. We're going to focus on acupuncture and dispel some of those myths, and also talk about some of the things that acupuncture can support you for and with. Blows my mind. I never knew until I started digging into it. Valerie Brinkman joins us on the program today. How are you doing?
I'm fine, thank you. Doing well. And you? You doing okay?
Student is here. He has shown up like all of us and here to learn more. And full disclosure, I haven't had acupuncture before. I just haven't had time. But in a heartbeat, I'm going to make the time, be intentional, and get it done, because it can benefit you in so many ways. You know, initially you would hear those things to help you with maybe insomnia and, maybe help you stop smoking, whatever it might be. But the more I dig into it, my mind is blown, Valerie, about the number of things that it can help us with. How about a list? I mean, just a random list of things, top of your head.
Absolutely. Anything you would go to a Western doctor for, you go to an Oriental medical practitioner for. There's absolutely nothing to prevent you that prevents Oriental medicine from making an impact upon helping your body to heal from any dis-ease that your body is experiencing, mentally, physically, spiritually. And that's the beautiful thing about Oriental medicine, is that Oriental medicine never separated body, mind, and spirit. It's always been one unit. And it's just varying forms of materialistic makeup in the body. And well, let me backtrack actually a little bit, because that's really interesting. When I moved to Maine, I received my training in traditional Chinese medicine. I got it from a place called Emperor's College, which was at the time, I think they've moved. At the time, it was in Santa Monica, California, and it was one of the best. I mean, I was so fortunate to have that education. But what was interesting was that with traditional Chinese medicine, what they had done was there was a period of time in their revolution where China sort of turned their back on a lot of the organic Taoist root of Oriental medicine, and they tried to Westernize. And they began to sort of separate out the body, mind, spirit, and just address body, because they wanted to bring the same type of validity to acupuncture that chiropractors had brought to chiropractic work.
Yep.
Which that also is too bad, because the reality of it is that the strength of chiropractic medicine never lay in trying to Westernize it. It lay in the strength of the pulse of the spinal cord, the fluid that goes in, that flows through the spinal cord. But they lost that technique. Oriental medicine was in danger of losing that. And the teachers that I had when I was getting my master's in Oriental medicine, a lot of them came from China, and they had been trained in that conversion. I was fortunate enough to have one professor. His name is David Chan. He's still in California. I've lost touch with him, but he was one of my huge mentors. He was the one practitioner we had who never forgot the root of body, mind, spirit, and is all one. And I'm so grateful to him because he helped keep that in perspective for me.
Hmm. Body, mind, spirit. So, and we're not throwing Western medicine under the bus. I just want to get that out of the way. There is a place for it, especially emergency medicine and on and on and on. But oftentimes it treats the symptom and not the root cause.
Well, and just to, so that listeners have an idea as to where I'm coming from. I am a I have an ancestry, a whole history of my all of my family is involved in Western medicine. My grandfather was a general surgeon who practiced in Farmington. His wife, my grandmother, was a nurse, brilliant. They were medical missionaries. They went to Persia.
Mm.
My uncle was a doctor. My father was a neurosurgeon here in Portland.
Wow.
And I got very sick when I was in California. And I had a friend who tried to convince me to see an acupuncturist, and I laughed. I thought, oh, yeah, if acupuncture is going to work, my father, who was a neurosurgeon who worked with the entire nervous system, he would know about it. So it took me 2 years to get into an acupuncturist. And I was bowled over when I finally went in.
Wow.
Yeah.
Which I think I'm going to be the same way now that I've learned,
Yeah.
and we're learning here today, some of the myths, the misconceptions. So I get it. Now, I had an aversion to needles, and I changed my mindset. I'm going to be honest, grown man. It was only up until about a year ago, a year and a half, maybe. I would put off even a blood test. Yeah, I'll wait another week. Yeah, I'm not in a rush. I'll wait another week. And I flipped the script and I said to myself, all right, you're getting information, good or bad. You're getting it. You can take care of it. It's good. And then I almost turned it into, well, I know it's going to hurt for a second, but I wonder how long it's going to take. And it almost became a game. Now I don't even care. Like I've had 100 stitches in the past year for skin cancer, and so it doesn't even bother me anymore. Flipping the script. And we look at acupuncture. That needle, as I understand it, you could take like 5 of those and put that inside the needle where they draw blood, right?
It's about the width of a hair, a strand of hair.
Yeah.
But more importantly than the fact that its diameter is so small, it's the way it's made.
Hmm.
An acupuncture needle is what we call a filiform needle, meaning that it comes down to a very fine, solid point.
Hmm.
When it goes through the skin, there's no bluntness to it. It presses down into the skin and it very gently separates the fibers, the skin, as it goes into the muscle tissue. As opposed to a hypodermic needle, no matter how small or teeny it is, it has to have a blunt edge because it's hollow. It has a form.
Yep.
And yeah. So the needle has a bluntness to it that no matter how teeny, it's going to be sharper. It's going to be more uncomfortable than an acupuncture needle. Totally different sensation.
Yeah. You don't know until you know. So our view of that is a needle in body. But what do people describe to you when you're doing acupuncture on them in terms of what it feels like? A little pressure, what?
Everybody is different. So some people don't feel it at all.
Mm.
And I'm one of them. I'm incredibly needle sensitive. My acupuncturist hates when she's got an appointment with me because she's like, oh God, here we go. So I'll lay down the table and she's tapping the needles and I tense up. And she's like, oh my God, Valerie, how long have you been doing acupuncture? 30 years. And I still get tense when a needle goes in because I don't like the idea of it. But it's a pressure. Sometimes you can strike a nerve and that can be uncomfortable. When it grazes by a nerve or it comes right in on top of a nerve, it's a nervy sensation, but that's rare. Usually people feel nothing. They feel a heaviness or an achiness. Sometimes it's just a slight pinprick, like when you're drawing blood for a diabetes test, you just do a pinprick on your finger. At most, that's what people say. But I have never had a client come to me that I've worked with that stopped because even when they've started, when they were afraid of the needles, that stopped coming to me because it was too uncomfortable. They just didn't enjoy the sensation. Nobody has ever left me.
Thank you, Valerie, for your transparency. This is somebody who does acupuncture, and the fact that sometimes you tense up, but on the back end of that, I'm going to say, I'm not putting words in your mouth, but I'm going to think that it's unfounded. You don't even need to tense up, but it's just we're programmed that way. And you just said finger prick. That's the one thing that doesn't work for me. That I don't know what it is. It's the digits. Like stab me in the arm with anything you want, but if you got to prick my finger,
Exactly. And there aren't any, well, there actually are acupuncture. I've never used them. No, the fingers, your fingers and your toes are incredibly sensitive.
mm.
I do not use those for acupuncture points. The rest of the body, it's not a problem.
Can you give us an example of somebody that you worked with, what they came to you for, and then what the outcome was, whether it was one session, five, however it went,
Oh, Steve. Gosh, I mean,
anything.
yeah, I've had people where I've seen them 3 times and we're done. We achieved the results we wanted. Perfect. People with a back pain, specific back pain. Pain is usually the easiest to be able to. But then people who get acupuncture regularly, like I'll maybe see them 4 times a year and they come in for what we call a tune-up. And they're in touch with their own bodies and they just need a little bit of help in being able to get redirected, and maybe talk a few things over as we get that body unblock those areas that are keeping their energy from flowing freely in their bodies. And they go, I've seen people for I've had clients that I've seen for years. So it really depends upon the individual and what they're after.
Hmm. What were you after? I want to hear your journey. And as I understand it, you started with one modality, then you got thirsty and wanted to learn about other ones and other ones. Take us to the beginning.
Like I said, I grew up the daughter of a neurosurgeon, and my father's career was the center of my family's life. He was gifted, he was wonderful,
Hmm.
and he was not just a doctor, he was a healer. He was the type of doctor that when his patients, many of them who after they had been released from the hospital, when they had gone home and been discharged, he would stop off at their homes just to make sure they were adapting okay
Wow.
to be he my and the thing that amazed me the most about my father was that when I became an acupuncturist, he never made me question myself.
He never
And
what? I'm sorry. I want to make sure I heard you.
he never made me question myself. He never berated me. He had great doubts himself. His friends gave him a terrible, terrible time about my choice of career. And all he said to me was, if you are helping people stay away from drugs, medicines, and if you can help keep people out of surgery, you've got my support. So I became very sick. I was diagnosed with inflammatory bowel disease when I was in college. And it hit again when I had moved out to California and I got incredibly sick. And I had been on prednisone. And this is what did the number on me. At the time, this was back in the late 70s, early 80s, I was on prednisone for close to 10 years.
Hmm.
It did a number on my body. And I went to see an acupuncturist finally at the advice of a friend of mine after 2 years of him trying to convince me to go. And I lay on that table. The man who was my husband at the time was with me. Lois Ann Keller was my acupuncturist, beautiful woman. And I'd gone to a woman who had been a nurse because I thought, okay, she'll be able to explain to me. She had been a nurse in Oregon and transferred her career, blossomed it into Oriental medicine. And basically what she said to me was, give it up. Western medicine and Oriental medicine are two different medical paradigms. Their laws do not intersect. You just stick to the paradigm, stick to the laws of that medicine, and you can help people heal. So I tried, but I'm so Western oriented myself. I found that very difficult. I kept going back all through my life in doing Oriental medicine. I kept going back and thinking, well, how does this relate to Western medicine? What's happening? But that first acupuncture treatment, I lay on the table and I thought, what on earth is going on? And suddenly I began to sob. And I mean sob. This feeling of blocked, suppressed energy just bubbled up from my gut and right out through my chest, and I couldn't stop. And my poor husband was like, well, something's wrong. I'll go get the acupuncture. I said, no, this is supposed to happen.
You had a release. You had a release of energy, a release of emotion.
It both.
Well, yes. Can I say this? Can I say this? To my understanding, acupuncture is about the flow.
Yes.
And it seems that maybe things were stuck for you, and now you let it flow.
That's exactly what it is, Steve. I in Oriental medicine, all problems are the result of blockages. Pain, any type of pain, emotional, spiritual, or physical pain, all come through because something is blocked.
Mm-hmm.
Same as in Ayurvedic or chakras, or you've got to open things. There's got to be a free flow of energy. And that's what the acupuncture does, is it opens things up so that where you've got these blockages, it's like putting a huge hole into the wall of a dam and letting that force come on through.
Well, Valerie, I guess we even look at it this way, even if somebody doesn't subscribe to any of this, when we cry, we're releasing.
That's right.
There's a reason that I believe we're the only mammal that cries for emotional reasons. Other mammals do, but that's to cleanse their eyes and things like that. We are releasing toxins. We are releasing chemicals and so much more. And that's just one example of letting it flow. Let the tears flow. And people feel so much better.
Right. Or also for children, it's very important to let them express their anger in a safe environment.
Sure.
Allow them to be able to express that in a way that's safe. Yeah. Absolutely.
So I want to do this today. I'm talking about acupuncture, myth or fact. And I'd love to do this maybe in a rapid fire way. I'll just fire these things off, and you just, tell me whether it's a myth or fact, and maybe a sentence and your thoughts on that. Here we go. First one, acupuncture, myth or fact. Acupuncture only works if you believe in it. Myth or fact?
Myth. And I'll tell you why. It works the most effectively on animals and on children. So go figure that one out.
Duly noted. Myth or fact, acupuncture can help reduce stress and anxiety.
Absolutely. Yes. Fact.
Gotcha. What can you tell us?
Again, it's about releasing those blockages. If you have a mental block, for example, me reacting to needles every time when somebody comes close to me with an acupuncture needle, I tense up, even though I know it's going to feel good. We have preset ideas and we create mental blocks. And what the acupuncture does when done in a correct environment, in the correct way, and you can get into it, all of those mental, you give over to what's happening within you internally, and you put away all the judgment, all the thoughts, all the feelings, and things just begin to flow from your brain to your body. And there's a connection, mind, body, brain, body connection that's made that deep meditation will do it as well. Deep prayer, deep meditation. You do not have to use acupuncture. There are many ways of getting into that Zen state.
For another podcast, even talking about meditation, and it took me a while, quite some time, to really get into that zone. But I got to tell you now, Valerie, I crave it. I'll go through times where it's like something's off. You need to just do nothing and sit by yourself. Stop. Yeah. And it's like, and I'm feeling it like in the next couple of days where I just need to be alone. Thank you very much. All right, I've heard this one. I don't judge anybody, for believing things or believing what they hear. Myth or fact, the needles in acupuncture inject herbs and medication.
Traditional needles, no, that's a myth.
Okay.
Now there is something that's called Western medicine they are beginning now to use more hypodermic needles, and they are using that for inserting for herbal essences, but traditional Chinese medicine, no, that's a myth.
Gotcha. Myth or fact, once you start acupuncture, you have to go forever.
No, that's an absolute myth.
Mm.
It again, acupuncture is one modality of helping people to be able to heal themselves. You can do it with Western medicine, you can do it with, although that's different. It's getting into a place where your brain and your body connect, and your ego, your judgments are totally put to the side,
Mm.
and you become your that becomes irrelevant. The energy that's within you is what becomes relevant. You can, the artists do it through their artwork. Um, Poets can do it through their no, that it's yeah, there are many different modalities that help people to be able to heal. Oriental medicine is just one that I'm in love with because it's so elegant.
And I threw that one in there because everybody says that about going to a chiropractor. Once you go to a chiropractor, you gotta keep going. That's a way. That's how they got you. No.
No,
Yeah.
in fact, what I love doing is helping people to be able to connect inwardly with their bodies so that through their own meditation, through their own visual process and their own learning to connect their brain to their body, that people will be able to do it themselves. That's always my goal,
Mm.
for free, and allow them to be able to do that meditative work and get to that place on their own.
Yeah, hypnotherapy was a big game changer for me, along with other modalities. But to your point, I got to a point where if I really am intentional, I could hypnotize myself. I mean, we're in a hypnotic state normally. We don't even realize it during the day, and that's just a natural state.
Yeah.
But it's just what you're talking about, to get to the point where you can do it. And I wonder, even, is it even possible, because acupuncture addresses certain meridians and pressure points on your body, could you even just press those points and get a result?
Absolutely. And you don't have to press them. What I'm beginning to
Hmm.
experiment is working with people, and we talked a little bit this about before we went on the arrows, to help people focus on certain acupuncture points or meridians, and for them to envision the energy gathering there and then bringing it to another point and helping guide them through that so that they learn how to make that free flow themselves.
Wow. I got to tell you, it is wonderful talking with you. It really is. You have such clarity. You get to the point. It's easy to understand. You're genuine. You're authentic about your journey. I don't think I've ever heard somebody who does acupuncture say, "Yeah, even when I get it done, I'm a little apprehensive about the needles," but kind of for no reason. That's just the way we're wired. We're expecting to feel something. It's like, oh, that was it. There's nothing. And time and again, you've had it done, and you think the same way.
Yeah.
It's normal.
Yeah, I've spent way too much of my life worrying about appearing or looking perfect, and it's absolutely ridiculous. Absolutely ridiculous. I find it much easier just let it on out there, let the chips fall. Just be honest. It makes it so much
Isn't
easier.
that the truth? If you could go back in time and talk to your younger self, I know I would say this. Why did you ever worry what people thought? Don't ever do that again. Yeah, but you know what? Takes a journey, with experience and age and everything. How do we connect with you, Valerie? I know that you're in Maine. Obviously, for acupuncture treatments, it's hands-on. You got to be in that geographic area, but certainly picking your brain about herbals and other aspects of Chinese medicine. What's the best way to reach you?
Probably the best way. Let me grab my phone here, make sure I get the right. I have an email address that anybody can contact me at and send me any questions that they have.
Sure.
And that address, oh, here it is. Mm, mm. It's OPA.
Is that
There we are.
V is in victory? Because I have that here.
Yes, V is in victory.
Brinkman
Oh,
at
that's not gonna do it.
gmail.com. So
Yeah,
I have
yeah, yeah.
OPAV
Yeah,
Brinkman.
OPA Brinkman at gmail.com.
Yeah. Yeah. So one more
It was
time.
for on point
Oh, on point.
OPA,
Oh,
on point
gotcha.
acupuncture.
Oh, I
Yeah.
love that name. It makes perfect sense. On point, like OPAV
OP
Brinkman at
at
gmail.com. Beautiful.
You got it.
Fantastic talking with you today. I'm excited to get stuck. I never thought I'd say that. So much more for us to talk about. So many aspects of Chinese medicine, even digging into herbals at some point. Would love that. And I appreciate you being here today. Thank you so much.
My pleasure. Thank you, Steve. I look forward to it.
Likewise. We'll be right back.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.